Hi, welcome back. Anorexia nervosa, commonly referred to as anorexia, is a complex and potentially life-threatening eating disorder that goes far beyond the desire to be thin. It is marked by extreme self-starvation, an intense fear of gaining weight, and a distorted perception of body image. Despite being severely underweight, individuals with anorexia often see themselves as overweight. This mental health condition affects people of all ages and genders, though it is most commonly diagnosed in adolescent girls and young women. The disorder not only affects physical health but also severely impacts emotional and psychological well-being. There are two main subtypes of anorexia. The restricting type involves extreme limitations on food intake, often accompanied by excessive exercise. In contrast, the binge-eating purging type includes episodes of overeating followed by attempts to eliminate the food through vomiting, laxatives, or other means. Regardless of subtype, both forms can have devastating consequences if not treated promptly and effectively. The causes of anorexia are multifactorial, involving a combination of biological, psychological, and sociocultural influences. Genetically, individuals with a family history of eating disorders, depression, or anxiety may be more predisposed. Neurochemical imbalances in the brain, especially involving serotonin, can also contribute to obsessive thoughts and mood disturbances. On a psychological level, traits such as perfectionism, low self-esteem, and an intense need for control are commonly observed in those with anorexia. Additionally, traumatic experiences or stressful life events, such as bullying or abuse, can act as triggers. Sociocultural factors play a powerful role in the development of eating disorders. In many societies, thinness is glorified and associated with success, beauty, and self-discipline. Media portrayals, fashion standards, and the rise of image-based social media platforms can reinforce unrealistic ideals of beauty. During adolescence, a time of identity formation and peer influence, this pressure can be especially damaging and may push vulnerable individuals toward disordered eating behaviors. Recognizing the warning signs of anorexia is essential for early intervention. Physically, it can manifest as dramatic weight loss, fatigue, dizziness, hair thinning, and absence of menstruation in females. Other signs include feeling cold frequently, constipation, and fine hair growth on the body known as lanugo. Emotionally and behaviorally, individuals may become withdrawn, irritable, or anxious. They often develop obsessive eating habits, such as cutting food into small pieces, avoiding meals, or denying hunger altogether. These signs are often hidden, making it difficult for loved ones to detect the problem until it becomes severe. Left untreated, anorexia can result in serious and sometimes irreversible health complications. Starvation affects every organ system. Heart problems, including arrhythmias and heart failure, are common and potentially fatal. Bone density loss can lead to fractures and early-onset osteoporosis. Other complications include kidney and liver damage, infertility, electrolyte imbalances, and even brain shrinkage, which can impair thinking and memory. Tragically, anorexia has one of the highest mortality rates of any psychiatric disorder due to both medical complications and suicide. Diagnosis involves a comprehensive evaluation, including physical exams, psychiatric assessments, and laboratory tests. A diagnosis of anorexia includes restricted food intake leading to significantly low body weight, an intense fear of weight gain, and a distorted view of one's body or weight. Due to the deceptive nature of the illness, individuals may not recognize the seriousness of their condition, making professional assessment essential. Treatment requires a multidisciplinary approach tailored to each individual's needs. The first priority is often medical stabilization, especially when malnutrition poses an immediate danger. This may involve hospitalization. Nutritional rehabilitation follows, where dietitians work with patients to reintroduce food in a structured and safe way. Psychotherapy is a core component of treatment. Cognitive behavioral therapy helps challenge distorted thoughts and behaviors, while family-based therapy has been especially effective for adolescents. Other therapeutic approaches, such as dialectical behavior therapy or interpersonal therapy, may address emotional regulation and relationship challenges. Although no medication can directly cure anorexia, Antidepressants or antipsychotics may be prescribed to manage coexisting symptoms like anxiety, depression, or obsessive thoughts. Prevention and early intervention are crucial in reducing the long-term impact of anorexia. Encouraging a healthy body image from an early age, fostering open conversations about food and self-worth, and teaching critical thinking about media messages can help reduce vulnerability. Educators, parents, and healthcare providers should be vigilant about early signs and intervene before the disorder becomes entrenched. The sooner treatment begins, the better the prognosis. It's a long-term journey that requires patience, support, and ongoing care. Even after physical health is restored, emotional healing takes time, and relapses can occur. Continued therapy, involvement in support groups, and strong social networks are critical to long-term recovery. Many people who recover from anorexia go on to lead fulfilling, meaningful lives, but they often carry the experience with them in some way. In conclusion, anorexia nervosa is a serious mental illness that affects both the body and the mind. Thanks for watching. Please subscribe, like, and share.